Hello, everyone. My name is Krista, and I will be presenting my mentor-mentee program that I implemented at my job. So as I said, I did my project with my employment, and currently I am employed with Riverside County Behavioral Health as a behavioral health specialist too, working in mental health services, specifically at a mental health clinic, working with adults ages between 26 and 59 and a half. The social problem, one of the things that I have noticed and have seen while I was at work is the higher turnover rates and how quickly people are leaving within the job force. Individuals were leaving within only being there within 2 weeks of the job. Um, Research showed that those at work in mental health are faced with stress, burnout, lack of opportunities of professional growth because we work in a demanding and emotionally charged workplace. There's lower retention rates, higher turnover rates due to stress, burnout, and lack of opportunity. The needs that I've seen, of course, were job burnout, working in the profession, increasing over time because of the changing work phase. There was a growing caseload, unclear roles, dropping in pay rate. Work productivity had been lower, the lack of job satisfaction and turnovers. So when one person leaves, of course, in case management, they split their caseload and it's piled on to everybody else. Sometimes we would have workers that had 30 plus people on their caseload because we were already short staffed. And we would have to split those 30 plus people amongst each other, seeing how there was only 30. I'm sorry, seeing how there was only 8 of us that were case managers. So that in turn stressed was created burnout, and also the unclear roles came from we had peer specialists that worked as case managers, just because we were trying to keep afloat with the many individuals that we had. So what I introduced was a mentor-mentee program, a mentorship program where we would have new employees that were coming on, um, go through a 6-week training process of how it is that a seasoned individual who has been at the clinic usually works. So starting off with week 1, there would be a program orientation, a meet and greet with the mentor and mentee so that they can get to know each other, and just have like a better understanding of what their goals would be for each other during this program. Week 2, they would implement ride-alongs where the mentee would follow the mentor around, and the mentee will observe how the mentor worked and while conducting home visits, being in the community, and learning about all the different community resources that were available that could be shown. In week 3, there would be the teaching of the note process and care plan notes, just trying to teach how simple it is to completing notes so that there wasn't the stress of I need to write these notes as long as possible to be able to get all the information in based off of county standards. For week 4, the mentor would have the mentee shadow them while working triage. Triage stands for at our clinic an officer of the day, where they take all crisis calls if the acting case manager is not in. They take screenings for individuals who are wanting services. They talk to all individuals basically. If the case manager is not there, then the triage person is definitely doing double the work of for that day. So in week 5, the roles would be reversed, of course. The mentee would finally take on their first case, their first client, and the mentor would observe the way that the mentee provides case management and offer ongoing support from there. After week 6, the mentor is now shadowing the mentee as they continue to support each other, going out into the field together, and just overall watching how they operate within each other. For this project to be able to happen, I presented it to my supervisor and a few selective coworkers, based on, of course, my supervisor's approval, who she would want to include in this. We had a total of 4 people, myself being included as one of the mentors. Then in the next step, the mentee, of course, would have to agree to the pilot program. And then it was presented to the mentors to see if they would agree to take on this extra challenge. The outcomes, of course, like I said, there was 4 individuals, myself included, found that it was extremely helpful. They truly enjoyed having one person they can learn from rather than the whole clinic, to keep everyone has everything. Everyone does everything differently. So the saying around our clinic currently is that everyone does things differently. So if you go to if you are shadowing many different people, you are seeing how things are being done differently, and it can create a type of stress on the new learner because this person does something differently, this person does something differently. So it just in turn can stress a worker out when they're learning new things. The survey provided great feedback. Overall, the effectiveness of the program, they liked it. The one thing that I learned was the individuals would like the program to be longer. And as I said, one of the main takeaways that I learned from this progress was that we would want more weeks to be added. The feedback was provided that the program was not long enough. This just created a bond between the mentor and the mentee, to which the mentee can continue to ask support from the mentor, whether it's case management. I think that they just created this bond within each other to make sure to be able to come to that one person when they need something. So, thank you.